Welcome to today's HealthLine webinar from the American Association of Kidney Patients titled A Game Changer in Vascular Access, Unveiling the IN.PACT AV Drug-Coated Balloon. My name is Jerome Bailey, and I am the Director of Patient Engagement and Advocacy at AAKP. AAKP is pleased to launch our Innovator Webinar series, an extension of our normal HealthLine webinar programming. The content of this program, as presented, and financial support of this webinar was provided by Medtronic. As the oldest and largest patient-led kidney patient organization in the U.S., AAKP is proud to host this Innovator webinar as a service to our expanding national and global communities of patient consumers and their families, medical practitioners, researchers, and policymakers following innovation and advancements in kidney care and treatment. AAKP is an aggressive supporter of innovation to change the status quo of care. While this activity is an approved educational webinar, AAKP does not endorse this webinar, nor endorse or promote any specific commercial entities or products. Thank you again, Medtronic, for sponsoring this webinar. AAKP's HealthLine webinars fall under our Center for Patient Research and Education. We believe patient and care partner education is an integral part of treatment and protection of patient lives, and we work to ensure that the patient has a central role in research and guidance that are designed to determine optimal approaches and strategies for providing healthcare services, assistance programs, and access to new products and services. We built this center with the latest polling and engagement technologies to ensure that kidney patients take a central role in informing the federal, academic, and private sector research shaping the next generation of healthcare services, assistance programs, and innovative new treatments. We encourage you to respond to our flash surveys and other engagement opportunities that you receive via email as a member of AAKP. As the oldest and largest independent patient-led kidney patient organization in the U.S., AAKP is proud to host this webinar as a service to our fellow kidney patients, family members, and care partners, healthcare professionals, researchers, and policymakers. AAKP is a champion for full patient care choice, the protection of the patient-doctor relationship, and the elimination of barriers for patient access to available treatment options. Today, we're diving into a crucial topic that holds immense significance for patient well-being, keeping a healthy dialysis access. Often held as the lifeline for individuals undergoing dialysis treatment, the access plays a pivotal role in both your treatment and overall health. It's absolutely vital to keep your dialysis access in tip-top shape as it directly impacts your well-being. There are 4 types of dialysis access. Today's discussion will focus on the arteriovenous fistula, or AV fistula. Medtronic has introduced a new device that prevents the narrowing of blood vessels in an AV fistula, helping to preserve the fistula for dialysis. We have 2 speakers today. Dr. Amit Baku is board-certified vascular and interventional radiologist. After graduating with honors from the George Washington University in Washington, D.C., Dr. Baku earned his medical degree at the George Washington University School of Medicine and Health Sciences. He completed a diagnostic radiology residency at Mount Sinai Medical Center in Miami Beach, Florida, then completed his training with a vascular and interventional radiology fellowship at the University of Michigan, Ann Arbor. He joined the staff at Lakeland Vascular Institute in 2022. Prior to that, he practiced in Clearwater, Florida, and Memphis, Tennessee. An active member of the Society of Interventional Radiology, Dr. Baku is currently a member of the Early Career Section Governing Council. He is also a member of the American Association of Physicians of Indian Origin. We are also joined by Thomas Carter. Mr. Carter is a dialysis patient from Lakeland, Florida. He will share his kidney disease story and his dialysis access care journey with us in a moment. But to begin, I will turn the presentation over to Dr. Baku.
Thank you for the very kind introduction, Jerome, and thank you all for joining us. Our topic today is regarding treating narrowing of AV fistula. So we're talking today about keeping your access site open in terms of maintaining hemodialysis access. Briefly today, we're going to give a quick overview of what an AV fistula is and how we can use drug-coated balloons, specifically the IN.PACT Admiral, to treat narrowing of an AV fistula, how it works, what the benefits and risks are, and who's a good candidate. We'll show a couple quick case examples, and then we'll get Mr. Carter's perspective here in terms of what it's like to be treated with a drug-coated balloon for AV access issues, and answer some questions at the end. In terms of hemodialysis access, there are three ways to maintain hemodialysis access, either through a fistula, a surgical graft, or a tunneled or non-tunneled hemodialysis catheter. An AV fistula is the most common type of access, and it connects the artery to the vein, typically in the arm, to serve as an inflow and outflow circuit to increase blood flow for efficient dialysis and provide a safe and easy way to access the bloodstream for dialysis several times per week. Over time, however, it can result in issues with the fistula, and it's important to address these if they occur. If the fistula is not working well, you may be not getting enough dialysis, and it can sometimes happen where you have a narrowing of the dialysis outflow vein or the inflow vein near the anastomosis, and that can result in turbulent blood flow within the fistula, damaging the wall of the fistula. And in an attempt to repair this damage, your body adds new layers of cells, which can narrow the fistula, something that we call neo-intimal hyperplasia, or growth of new cells, the neo-intimal part, within the fistula wall. And there's a diagrammatic representation of that on the slide. So the warning signs of a narrow or thrombosed fistula would be the absence of a vibration or thrill at your fistula site, arm swelling, prolonged bleeding from the access site, which usually means that there's an issue higher up in the arm or in the chest veins, numbness, tingling, coldness, or weakness in the arm, or highest venous pressures on the dialysis machine when you're at dialysis, or poor inflow. In terms of treating the narrowing of the fistula, you may require a maintenance procedure for that. And there are a couple options with which we can treat this with. Traditionally, we've used non-drug-coated balloons or traditional angioplasty, or POBA, plain old balloon angioplasty, which is a balloon placed into the fistula through a catheter and inflated in the narrowed section and then deflated and removed. Patients typically have done well with that. But over the past couple of years, newer technology has emerged, specifically a drug-coated balloon, which uses an anti-proliferative drug to address that cell growth or that neo-intimal hyperplasia within the wall of the fistula to decrease the need for further intervention and ensure that the fistula stays open for a longer period of time after the procedure, as opposed to a traditional angioplasty balloon. And specifically, with Medtronic, they have a IN.PACT AV fistula balloon, which is a drug-coated balloon used for fistulas. And what is the IN.PACT AV fistula balloon? It's a proactive treatment to increase the duration during which patients are able to go without needing a further dialysis intervention. It's a drug-coated balloon specifically formulated in using a paclitaxel drug in a similar way to a traditional angioplasty balloon that's put in the fistula and inflated, and the drug gets absorbed into the wall of the fistula that works to decrease the need for further interventions down the road by decreasing the further growth of cells and the hyperplasia we can sometimes see with fistulas over time, helping the fistula stay open for longer. In terms of how the IN.PACT AV fistula balloons, it's very similar to a traditional balloon, as I mentioned. And the balloon is placed over a wire within the fistula or hemodialysis circuit. The balloon is inflated, creating a channel within the fistula itself and putting the drug into the wall of the fistula and then slowly deflated and removed. And the only thing that's left behind there is the drug within the wall of the fistula to decrease the further growth of cells and prevent further narrowing of the fistula over time. With this newer technology, and specifically the IN.PACT AV fistula drug-coated balloon, there's 56% fewer fistula procedures through 6 months, decreasing the number of times that patients need to come back for further intervention, ensuring that they're able to dialyze without further complications over that time. There are risks with drug-coated balloons for which you can follow up with your physician in terms of the specific related to this procedure. Questions you want to potentially ask if you find yourself having the need for repeated interventions or procedures to maintain the patency or opening of your fistula would be, is the IN.PACT AV balloon the right thing for me at this period in time? What are the advantages relative to traditional balloons? And can this decrease the number of procedures that I need to have in the future? So a couple quick case examples of patients that I've treated with drug-coated balloons. So in our first case, this is a gentleman who came in with a poorly maturing AV fistula. And you can see on the edge of the screen there towards the left side of the screen, he has an edge stenosis next to a previously placed stent related to that growth of cells or neointimal hyperplasia in that area. We were able to take a drug-coated balloon along the narrowed segment and adjacent to the stents area and open up the fistula using the balloon to get better patency, and he went on to dialyze well. In our second example, this is a older gentleman with diabetes-related kidney disease requiring hemodialysis, and you can see that there's a clot in his mid-cephalic vein, right where that vessel in the middle kind of cuts off going from left to right. We were able to successfully remove that clot and use the drug-coated balloon to treat that segment. We can see that here, once we were able to remove the clot, we used the drug-coated balloon to treat that segment, and the bottom left angiogram shows that there's brisk flow through the treated segment there in his cephalic vein. And the right image will be showing, again, brisk flow going through the cephalic vein into the chest veins, and he went on to dialyze well. And so we're going to get a couple of thoughts here from Mr. Carter and our patient perspective. And Mr. Carter, can you tell us a little bit about yourself and when you were diagnosed with kidney disease and kind of what led you to needing dialysis?
I was diagnosed 2 years ago, which would be 2022. I got where I couldn't go to the bathroom anymore, and they decided I needed dialysis, and I went to a surgeon at another place, and he did a graft, and I had trouble with it within 2 or 3 weeks after doing it. I came to Dr. Baku, and he's fixed it, and it's been fixed for probably 3 or 4 months, and I hadn't had a bit of problems.
And before our procedure, Mr. Carter, can you tell us how many procedures you've had previously?
I had 2 procedures prior to Dr. Baku doing his procedure, which has worked wonderfully. I go to dialysis, they stick me, and I have no trouble whatsoever. Before when I go, they couldn't find the grafts at all. They'd had to poke around, and then sometimes they'd miss it, and sometimes they'd get it, and it was just a nightmare to be stuck with the big needle and trying to find this thing. But now they hit it the first time. I don't even feel it when they stick me.
Thank you for sharing that. When you had the procedures, with me here, can you tell us what it felt like when you had the procedure? What was your experience like, kind of, coming in, having the drug-coated balloon procedure, and then subsequently how you've felt after that?
Be honest with you, I didn't feel nothing. I just laid there and just knew they were working on me. I didn't have no pain, no nothing, and it was a good atmosphere. These coworkers were very, very competent, and it was all business, and it worked great. And ever since then, I've been doing real good with it.
Great. And in terms of after the procedure and all that, has that led to any changes or improvement in your day-to-day experience and with dialysis as well?
It's really left things a little bit better. It's improved. I don't have near the soreness and near the weakness that I had before.
Great. Thank you, Mr. Carter. Jerome?
Thank you, Dr. Baku and Mr. Carter. That was a really great presentation from the both of you. We have a few questions that people submitted when they registered for today's webinar that I'm hoping you can address. The first question is for you, Dr. Baku. How do you determine if your patients are a good candidate for a DCB maintenance procedure?
Thank you, Jerome. Typically, I look at the fistula or graft anatomy, typically the segments that we need to treat, where the underlying lesion or thrombus is, and then kind of decide from there, weighing the pros and cons in terms of what the best approach is here to address that lesion. Typically, for patients with neointimal hyperplasia, an underlying lesion that's led to some thrombus or narrowing of the vessel, those are the patients that I feel like do best with drug-coated balloons to decrease that further growth of cells or neointimal hyperplasia in that area. And those are the patients that typically do the best in terms of long-term outcomes to have further dialysis without the need for additional interventions.
Yeah, can you talk a little bit more about the type of results you've seen after your patients were treated with an IAV DCB?
Yeah. In general, with most of my patients, they've done really, really well, and many of them have not needed to come back for a further intervention for at least, 9 months to 1 year, if not longer. We do surveil our patients with ultrasounds every so often, typically once or twice a year, depending on how things are going, and also with feedback from the dialysis centers in terms of their pressures and how things are running with clearance at dialysis. But in general, using drug-coated balloons, most of my patients, in fact, I can't think of one that's had to come back for a repeat procedure within a short amount of time compared to non-drug-coated balloons.
And Mr. Carter, this question is for you. How did you learn about the type of procedures? How did you learn about the DCBs?
All I know is when I got stopped up and they couldn't dialyze me, they called around and the surgeon that had been doing it was not available, and they got a hold of Dr. McCoo, and I went to see him, and I can't remember if it was the Manatee County Memorial or whether it was at Lakewood Ranch, but I went to one of them and he did me, and that's when I first learned about it. And I really am learning a lot from this webinar.
Great. Another question for you, Mr. Carter. After the procedure, did your dialysis treatment change?
No, not at all. I went back the next day and they did dialysis and it worked fine.
Great.
Now, on the numbers, when they set the machines up, they couldn't get to the specific number they wanted to. And after the surgery, they were getting the numbers they wanted to. I want to say 400, but it's something, whatever that means. I'm not real familiar with that. And but everything's working fine. Right after the procedure, it worked fine.
Yeah, that's good to hear. Dr. Baku, one last question for you. What would be your recommendation for patients when talking to their physicians? What advice would you give?
Well, I would say that, when it comes to, hemodialysis access, whether it's a fistula or a graft, I think that you kind of have to understand and know if you're having issues with it, where is the issue and what's causing it? Is it a narrowing of the vessel? Is there a clot there? Or what's going on with it? And in terms of that, if there's a narrowing of the vessel and the physician suspects it's from neointimal hyperplasia over time within the hemodialysis circuit, that's something that's amenable to treatment with drug-coated balloons. And in terms of making sure we understand why the patient had the issue and treating it the appropriate way so that we don't have to have multiple interventions and that you get the best long-term results, that's, I think, the key takeaway that I always make sure that my patients try and understand in terms of why their access had an issue and what we did to treat it.
Thank you. And one last question for Mr. Carter. What would be your recommendation when talking to your physicians? What advice would you give other patients?
Other patients, I was letting no one but Dr. Bagu do it. He did a fantastic job, and I've had no problems since he did it. And don't anticipate any problems.
Great. Thank you. Thank you, Dr. Baku, for introducing our audience to the IN.PACT AV drug-coated balloon. And thank you, Mr. Carter, for sharing your experience with the device. If anyone watching has
Well,
any additional questions for our speakers or about today's webinar that we were unable to get to, please send those questions to info@aakp.org, noting the webinar title in the email subject line. I'd like to close today's webinar with a few slides on additional resources that may be of interest to you. If you are not already a member of AAKP, we encourage you to join. AAKP offers free membership to patients and their family members, as well as living kidney donors. To become a free member, join online at aakp.org or by phone at 1-800-749-2257. To receive all the benefits of membership, please be sure to include your email address when signing up. As an AAKP member, you will be notified by email when opportunities arise where your opinions and experiences are needed to help inform innovation, advance care, and make a meaningful impact to improve lives. We encourage you to respond to our flash surveys and other engagement opportunities to help us elevate the patient voice and change the status quo for kidney disease care. You can also select to receive any of our 5 different electronic newsletters. And I encourage you to subscribe to our printed magazine, AAKP Renal Life. We also invite you to follow us on our blog and social media for all the latest news and announcements. AAKP is dedicated to helping patients across the disease spectrum understand their condition and take control of their health care. We are proud to offer a variety of resources for both patients and care partners. By visiting our website at aakp.org and clicking on the AAKP Store button at the top of the homepage, you can find a variety of educational brochures and online tools to order or download, including our Understanding Your Hemodialysis Access Options brochure and our conversation starters, questions to ask your healthcare team about choosing the right therapy for you, and or questions to ask your healthcare team about changing dialysis therapies. You can also order materials by phone. We are excited to announce the dates of our 2024 events. The AAKP Policy Roundtable will take place on February 20th, 2024. This is a hybrid event with the in-person event happening at the National Press Club in Washington, D.C. The 6th Annual Global Summit on Kidney Disease Innovations, in partnership with George Washington University School of Medicine and Health Sciences, will take place May 2nd and 3rd. The 49th Annual National Patient Meeting will also be a hybrid event, taking place in September, the dates to be announced. And the 7th Annual Policy Summit is scheduled to happen in November and will take place in Washington, D.C. We invite you to let us know which events you are interested in participating in this year, and we'll be sure to notify you when registration is open. You can also visit our YouTube channel to watch presentations on demand from our 2023 events and programs. And again, thank you, Dr. Amit Baku and Thomas Carter, for participating in today's AAKP HealthLine webinar. We appreciate your time and effort in making this event meaningful and informative. We also want to thank Medtronic for the sponsorship of today's webinar. Thank you all for joining us today.